In the 6 months since Mom died, we have had 4 people within our circle of friends tell us of someone who died from C. diff. In some cases, they had other health problems. Cancer in one case, multiple sclerosis in another, but ultimately C. diff is what killed them. In some cases it was quick, in other cases these people suffered for months. The fact is, every day 300 Americans lose their lives to a C. diff infection. Public health officials estimate that 30,000 people will die of C. diff infections this year. That's more than AIDS or drunk driving combined. Let's let that sink in. Something most of you had never heard of, and probably never heard of before our mother got sick, will kill more Americans this year than drunk driving and AIDS combined. Yet, there is no public outcry, there are no resources for patients, there isn't any educational program for the public or laws to mandate the tracking of C. diff. There is certainly nothing that comes close to the scale of HIV education or drunk driving laws. Like a lot of other superbugs, C. diff started out as a troublesome but treatable infection. It mostly affected elderly people with compromised immune systems and people in hospitals and nursing homes. But over the last decade, new treatment-resistant strains have turned this infection from troublesome to lethal for far too many people. The newer strains of C. diff are 16 to 20 times more toxic than previous strains. Essentially, the kind of strain that Mom had, the difference between an old strain of C. diff would be like a 5-proof drink, and the C. diff that Mom had was like a 180-proof drink. And that's caused by mutation from the overuse of antibiotics. When antibiotics don't fully kill off a bug in your system, the bug that survives is much, much, much stronger. The Los Angeles Health Department estimated that C. diff mortality rate increased 35% every year from 1999 to 2004. One of the fastest growing populations acquiring C. diff is pregnant and postpartum women. Imagine the horror of bringing home your new baby and a week or two later becoming violently ill, possibly undergoing surgery, or the worst outcome, losing your life or losing your spouse. In 2008, 4 otherwise healthy people, a lot like Mom, died in Philadelphia from C. diff infections after they treated them with every antibiotic under the sun and removed their colons. 2 of those healthy people were new mothers. And the less virulent strains of C. diff will sicken 500,000 people in America this year. And C. diff is increasingly found outside of hospitals, what they call community-acquired C. diff. People like our mother hadn't been hospitalized since she gave birth to Liam in 1976. She probably picked it up visiting somebody in the hospital, or maybe from a kid at school. We'll never know. The booklets and bookmarks that you have found in your seats also contain information about C. diff. We want you all to take them home, learn about how to prevent and combat this disease, and spread the word to your friends, families, and doctors.